Staffing shortages are causing long wait times in Amarillo hospitals. As new coronavirus cases continue surging across the U.S., health leaders say there are no nurses available to come help. Tonight, an update as hospitals near capacity.
We are really almost at capacity in the hospitals in Amarillo and in Lubbock. If you come to the hospital and you are sick enough to be admitted to the hospital, you are likely to wait in our emergency room for quite a while.
Northwest's Chief Medical Officer Dr. Brian Wise says it's a major concern with school starting in 3 weeks when he expects to see the virus spread more.
So please keep yourself safe. Please do what you need to do to prevent getting sick. Vaccine, mask, distancing, everything. Because at this point, the hospitals are somewhat strapped to be able to take care of this surge of patients.
Public Health Authority Dr. Todd Bell says the strain on hospitals means they have fewer internal resources they can use.
I was seeing a patient this morning down in the emergency room that had been there certainly longer than what is the norm because we're waiting for a bed to be available. Well, that's the part of the issue, is that COVID actually puts a strain on the entire healthcare system, not just on those folks that are directly taking care of COVID.
Last fall, Amarillo hospitals ramped up during the surge, but Amarillo City Manager Jared Miller says that would be much harder to do now.
Because their available pool of employees and nurses that they need to be able to ramp up and step up operations like they did last time doesn't exist anymore.
RAC nurses also helped during the surge, but that help is not coming now.
There will not be any nurses coming from the RAC or from the state. We've been given a list of a number of nursing or temporary nursing agencies. They just calling a handful of them, they have no nurses available. So that's our biggest concern at the hospital, is that Calvary's not coming in. We don't have that help that's going to come back us up. So we're really dependent on the staff we have and keeping those staff well and protected.
Dr. Wise says they're already being forced to turn away outside patients.
I can tell you, just talking to some of the regional facilities, they've had certain days where they've had a patient that needed a higher level of care. And unfortunately, they could not get that patient to either hospital in Amarillo or either the hospitals in Lubbock because of these same constraints. So yes, unfortunately, we are finding that we are having to decline transfer requests.
Last fall, the Amarillo VA helped by taking non-veteran patients.
I was told last week that some of those talks have already started, but as of right now, I have not heard that we've been approved to accept what we call fourth mission patients. But I do want to highlight right now, our hospital is full too. So even if I had that approval right now, I would not be able to accept any.
Miller says if our hospitals continue to be overtaxed,
we can expect to see our residents and people who need to be in our hospitals and want to be in our hospitals being sent to other locations. No telling how far away. So we really need to take very assertive, proactive steps to make sure that we can maintain our capacity at our hospitals for our local residents.
Dr. Wise says several community hospitals still have staff and beds, but no doctors available. He says Amarillo hospitals are looking to send patients and use telehealth to connect them with critical care doctors at those hospitals if this surge increases.